السلام عليكم.
وعليكم السلام. Good evening, everyone, and welcome to your Path to Invention workshop. My name is Ragad Al-Harbi, and I'll be the moderator for this workshop. I'm delighted to introduce our esteemed speaker, Dr. Sاره المزيدي, consultant of neurophysiology, associated professor, and the research and invention unit member. Dr. Sاره is also the proud recipient of the Golden Medal at the Geneva Invention Expedition. At the end of the workshop, Dr. Sاره will answer your questions. So if you have any, please send them privately to me throughout the chat. And please remember to complete the attendance form at the end of the session. Now, without further ado, please join me in welcoming our distinguished guest, Dr. سارة المزيدي.
السلام عليكم ورحمة الله وبركاته. Thank you for joining us in this workshop, and I hope that you will benefit from it and to be motivated to submit your innovation by the end of this workshop. First of all, I want to thank Abdullah and Ragad from the Research and Innovation Club for arranging this workshop. I'm Dr. Sاره المزيدي. I have participated in many scientific competition and won in 2010 the Young Medical Research Award in the third meeting in the IBMS in Greece. I have won the Faqih First Summit for Health and Innovation, second place, alhamdulillah, and I have and our project also participated in the health hackathon at Al-Haras Al-Watani and was one of the top 15 innovations. And recently we have won the Golden Medal of Geneva International Innovation Exhibit. I'm happy today to share my experience with you and to guide you through the innovation pathway to win your next prize in innovation, inshallah. Since today we have students with us, I will give a brief introduction on innovation in medicine. Then I will discuss the process for participating in local and international competitions. Okay. So what is innovation in medicine? Innovation in general is a new idea or a device or a method. In healthcare, it is a new or improved health policies, practices, system, a product, a technology, a service, and a delivery method. So it's a broad term that includes many ideas for innovation. Why innovate in medicine? It's to improve the ability to meet healthcare needs and demands by optimizing the performance of the healthcare system. How to innovate? To improve the effectiveness. If you have a medical device or you have methods of delivery or you have a policy or a system, is to improve the effectiveness and quality and sustainability, safety and affordability of a healthcare system. So how did the healthcare innovation help us? It helped in digitalizing data record, and as we saw in during the COVID-19, the remote monitoring and the virtual clinics improve communication between patient and the healthcare system and between healthcare centers, better treatment options. The best topic in the past maybe 2023 and 2024 is lower health cost. So if you are thinking about innovation, go to lower health costs and to increase efficacy or efficiency of workflow. These are the top 10 innovation in 2024 and 2023. Number one, of course, in healthcare. Number one was artificial intelligence in healthcare. then cloud computing, mental health technology, virtual reality, which is the topic of our invention, or the category of our invention, the telemedicine, as we saw during the COVID-19 and still working, wearable devices. When I participated in Geneva, many of the participants had an innovative devices, and most of them were wearable. So you can think about a wearable device for your next innovation, and so on. So when you're thinking about innovation, I'm talking about a device because my innovation was a device. But it can be, as I said, an improved system or policies or whatever. So what is the components of innovation in medicine? First of all, novelty, then application, and we will discuss this point by point. Benefit, who are your target population? And the cost, the spelling mistake, the cost and sustainability of this invention. Failure of innovation in medicine. Maybe you have a good device or a good method, but you fail in packaging this device, so you cannot transport it. Delivery. Maybe your innovation requires special temperature for transport or special handling, so this will lead to failure of innovation. Of course, I'm talking about participating in competitions. Ineffective. Maybe you have a good idea and you have a good prototype and a good device, but when you tried it in real life, you found that this device is ineffective. User unfriendly. It might require special training and special personnel with specific degree to operate this device. The cost of this device is extremely high, and the benefit is low. So this might lead to failure of innovation. Finally, as we all know, fund. If you don't have fund, this is a big or a huge challenge in innovation. So if you know the components of innovation, and you know, and you've taken under consideration all the parts that might lead to failure of innovation, then you can start the next step. The next step is to have an expert team, the team who are related to your innovation. Then apply for a fund. You need a fund to apply or to okay, thank you. Okay, so you need a fund for your innovation. And then most of exhibitions for innovation require prototype, and some of them require patent. So you need to apply for a patent, and you need to apply for competitions or contests, either locally or internationally, depending on your innovation. Finally, how to market your innovation. Okay, so we will be talking about this step by step. First of all, we faced a challenge in finding a fund for our device, and we thought our device will be extremely expensive. And then when we were connected to an expert in marketing and an expert in biomedical engineer, we found much simpler way to manufacture our prototype. And we found that there are many areas that we can apply for a fund. So for our device, we applied for a fund from the university, but there are many more places that you can apply for a fund, and mostly for students. Students have more opportunities for funding for their innovations, such as المسك, موهبة, منصة الابتكار المفتوح. Usually they and sometimes exclusively they fund students. And the other areas such as research, development, and innovation authority, the CACST, and Ministry of Education fund individuals. And I found some, I have met some of inventors there that they were working at Ministry of Health and working at the private sector, but they were funded by the Ministry of Education. So you have many areas that you can find fund. Then you have to have a prototype. For Geneva and some other exhibitions, they require a prototype for winning. And this was a challenge for many of inventors there. We had a huge section in Geneva for Saudi Arabia, and 150 participants have lost their luggage in, I think, Saudi airline, or I don't know which airline. Not my airline, alhamdulillah. I had my prototype with me in the airplane. So most of them, 150 of them, have lost their luggage, and they have received their luggage in the last day of participation, and they were disqualified. So you have to have your prototype. It's a must for participating in Geneva. Okay. Then you have to apply for a patent. Some competitions do not require a patent, such as the health hackathon, but other competitions, they require a patent or just an ID for registration that you are applying for a patent. So this is one of the areas that you should consider while applying to a contest. You have to read the rules for winning and participating, if they require a patent or a prototype or just a registration or proof of registration for patents. Okay. Then you have to apply for competitions, and this depends on your interest or your innovation, national or international, and you have to have a sponsor. It is very expensive to participate in international conferences and exhibitions. It requires tickets, requires accommodation, transportation, and even registration fees. It requires decoration. I will show you the decoration إن شاء الله في آخر كم صورة. And it requires a lot of things to participate in international and national competition. So you have to find a sponsor. We were sponsored by the university, and they paid for everything from prototype and participation and everything. Finally, marketing. And this was the focus of the hackathon at the National Guard, الحرس الوطني. Marketing was the main theme in the health hackathon in the National Guard. They were focusing on the cost, they were focusing on sustainability, they're focusing by a lot of issues that are related to the financial cost and revenue of these innovations. So you have to consider marketing. And marketing, now we are working with Munshaat. Munshaat is a governmental sector that you can go to their website and register there according to your to the type of consultation that you need, and then they will arrange physical appointment that you can go and visit them, and all of these advices that they will give you to market your innovation is free of charge. So testing our invention, we had an expert team. We applied for a fund through the university. We had a prototype with the help of a biomedical engineer and 3D printing. We applied for a patent also through the university. We applied for competitions, Geneva, and we are working on marketing through منشآت. Okay. So in terms of components of innovation, novelty, yes, it is novel. It has not been done before. Application, yes, it is small, portable, and do not require an expert to operate. Benefit, the direct benefit is for the patient. It saves time. It is applicable, comfortable, and get the job done by any healthcare setting. The cost and sustainability, the cost was very low for people who know or they are working with medical devices. They see how these medical devices are very expensive, and this 20,000 riyal is nothing compared with other medical devices. Sustainability means that how can you make this, mostly for the investor, how you can make the hospital or the clinic that bought your device come back for you and request an update and request maybe more software, more cloud space. So all of this you need to think about when you are having a device for maybe you have a software or whatever invention you are thinking about. And the hackathon at الحرس الوطني اللي هو في الناشونال جارد. If you don't have a sustainability plan, they will not even consider your innovation or participation. So you have to have a sustainability and cost plan. Okay. So this is part of our participation in Geneva. We had, this is جامعة الإمام. We had 4 booths. This is my booth. You should have a poster to describe your innovation, including pictures and including the software or whatever things that you are targeting the audience to understand. And these extra things, I actually printed these specially, 3D printing also for this Lego, to be compatible with each other. And they have autism letters, A and U and T. And they have the 3 colors for autism. Why did I do this? Is to attract children and children from schools to come to my booth, and they were having fun and playing with the Legos while the reviewers were there and evaluating my device. Okay, and here you can see the children are having fun with displaying the virtual reality device. Okay, and this is the golden medal, alhamdulillah. Okay, so Geneva submission deadline is within 2 days. The requirements for submission in the 9th of October is only the proposal. And in the proposal, they have in the proposal the requirements for winning or for being participant in Geneva. So just follow these instructions. These was sent by a letter from the dean to all head of departments, and then they have an email that you can submit directly your proposal. But we request that anyone of the staff member who submit a proposal, please let us know, or just notify me directly through my WhatsApp that you have submitted your proposal to the email that is in the letter. And I think also the Innovation Club have received a copy of this letter. So please, whoever from the students submit to the email in the letter, please just notify the Innovation Club that you have submitted, so we can help you and we can follow up your application. Okay. Okay. The Health Innovation Hackathon, it will be in Riyadh في الحرس الوطني at National Guard. The submission deadline will be in the 14th of November. And يعني the same situation. If you have a proposal, you just need to submit a proposal. Actually, the hackathon or the health hackathon require some images of your prototype, or you have like a video. يعني you need to submit either images or figures of the device that you are talking about, either device or invention, okay? And then just an abstract about your invention, okay? The conference is in January, but the deadline is in November, okay? And there are many other competitions that are well known worldwide, such as the ITEX, and there is the International Invention for the Middle East. They have just announced the deadlines, but these require a patent. So if you don't have a patent, they will not consider your participation. And also, as you can see here, we have a lot of international and national innovation exhibits that you can just search online and find this exhibit for students. You can ask directly the Innovation Club to help you if you have an exhibit that you wish to participate in. And also for the staff, if you have any exhibit that you wish to participate in that is not announced by the university, please contact me, and we can help you in participating in these competitions, okay? So my advice, especially for the student, is to attend innovation boot camps. There are a lot of boot camps that are available for students, such as in MISC, in Munshaat, and also the university has many boot camps that are available throughout the year. In summer, there is Munshaat and MISC, مركز الابتكار وريادة الأعمال. I think it was by the end, يعني before summer, كان after Ramadan بدأوا البوت camp. So please follow up, and I strongly advise you that you attend these boot camp to help you in participating in these competitions. Thank you.
Thank you so much, Dr. Sara. I hope everyone enjoyed this insightful presentation. Due to time constraints, we will only be able to address 2 questions that have been sent to me privately. If anyone has any questions, please send it to me privately. Yes, Dr. Sara, we have a question. Is the searching in the internet is enough to determine if the idea is innovative?
Thank you for your question. You can search literature, and if you are a student, you need to find a doctor in our college. I'm sure there are a lot of doctors that have the same interest of the research that you are doing, and they will guide you through your innovation process. So yes, search the net, find an idea, find a doctor that has the same interest and same specialty, and this will help you in participating or in creating innovation. And it should follow the criteria that we discussed: the components of innovation, and avoid the components that make the innovation fail. Okay.
Yes, Doctor, for a last question, can you please explain more about sustainability?
Okay, sustainability, it's different from the sustainability that we all know about, إنه هو المفروض يكون اللي هو green على قولتهم. ف sustainability in innovation and in manufacturing devices, especially in the health hackathon at الحرس في National Guard, they require sustainability, which means that how can you make the person or the clinic or any person who will benefit from your device to come back to you and to request some sort of sustainability to ensure that this client will come back to you and he will need you. مثل عندكم الايفون تحتاج تسوي تحديث طول الوقت صح؟ فاور ديفايس احنا ما كنا حاطين الصراحه لا سوفت وير ولا حاطين كلاود. في الهيلث كير في الحرس استفدنا كثير من مشاركتنا، مع ان احنا ما كنا من الفايزين، ولكن استفدنا كثير ان احنا نعرف كيف نقدر نحافظ على الديفايس هذا، واكتشفنا ان عالميا sustainability is a must for any device that you are creating. So هذا تعريف sustainability. والحمد لله احنا لما كنا في جنيف واحد من الانفنشنز اللي فاز كان عبارة عن AI software that detects autism through the eye. ولكن لما كلمناهم قالوا احنا عندنا مشكلة كبيرة، كان ان احنا ما احنا عارفين نثبت البيشنتس ونصورهم. فقلنا خلاص هذا الكولابوريشن حصل في جنيفا، ان احنا الى الان في تواصل معاهم وهم في الصين، ان احنا نخلي جهازنا والاي اي سوفت وير تبعهم يصير compatible مع بعض ونقدر we can sell a device. اوكي، فهذا تعريف السستينابيلتي.
Thank you, Dr. Sara. Due to time limitation, we will now conclude the session. However, we will soon announce a special session to answer all students' questions. And for the faculty members, we kindly ask that you reach out to Dr. Sara directly for further inquiries. Thank you once again, Dr. Sara, for that wonderful presentation. It was indeed a pleasure having you with us. Before we conclude, I would like to kindly remind everyone to complete the attendance form, and thank you all for your participation.